Hi, I'm Dr. John Leonard from the Lymphoma program at Weill Cornell Medical College and New York Presbyterian Hospital. Welcome to our review of emerging data for lymphoma patients, or REDLAMP program, where we try to provide you some information regarding new studies that have been presented in the literature that may be of interest to patients with lymphoma. So today I'm going to discuss a recent publication from the New England Journal of Medicine. It's entitled Bortezomib-Based Therapy for Newly Diagnosed Mantle Cell Lymphoma. So as many of you may know, mantle cell lymphoma is an unusual type of lymphoma. It's roughly 10% of patients with lymphoma. And there's a great deal of discussion about what is the best treatment for patients with mantle cell lymphoma. This can range from observation if patients are asymptomatic to chemotherapy. Chemotherapy with rituximab is one of the standard approaches. Many patients go on to receive an intensive approach like autologous stem cell transplant once they go into remission. And then there are a number of novel approaches in clinical trials for this patient population. So patients newly diagnosed with mantle cell lymphoma in particular have a number of options, and really it can be a very complicated discussion as to what to do. In older patients, typically, less aggressive chemotherapy approaches are used, but again, there's a wide range of options as to what patients can do. One of the commonly used chemotherapy regimens has been R-CHOP, particularly in the older patient population, and this goes back over several years. R-CHOP is the most commonly used regimen for aggressive lymphomas, and I would say that it's one of the regimens sometimes used for mantle cell lymphoma. So this study looked at a comparison of R-CHOP versus a substitution in the R-CHOP regimen where one drug, vincristine, is removed and a new drug or another drug, bortezomib, is substituted in. Bortezomib is a proteasome inhibitor that is an intravenous drug or subcutaneous drug, can be given in a couple of different ways, that by itself is active in mantle cell lymphoma and is one of the treatments that we sometimes use in relapse patients. And this study asked the question, could we use it as part of initial treatment, substituted in as part of the R-CHOP regimen? So this is a randomized trial looking at R-CHOP versus R-CHOP substituted in with bortezomib for vincristine. And so this study, the median age of patients on this study was 65. There were some younger patients, but the majority were relatively older and therefore not getting a more intensive such as stem cell transplant approach. It was an international study. It had about 500 patients or so with newly diagnosed mantle cell lymphoma. And so this treatment regimen was given over 6 cycles, basically, a fairly standard fashion to this patient population. And the net of this was that the outcomes seemed to be better in the patients that had the bortezomib-containing regimen. The progression-free survival, meaning the time that it took for the disease to progress, was roughly 24 months in that group versus 14 months in the standard R-CHOP. So there was a greater efficacy as reflected by the time that it took for the disease to progress in the patients that got bortezomib as part of their treatment. There was also a trend, though not a proof, a statistically significant proof, toward a possible benefit in overall survival, meaning how many people are alive down the line. And so this suggests that bortezomib may add value as part of chemotherapy as initial treatment for mantle cell lymphoma, again, in this case, in the R-CHOP regimen. Now, there was a cost to this, and the cost really relates to more side effects. There was a bit more in the way of low blood counts. And so, like most things, there are trade-offs. And in this case, having a more effective regimen had a little bit more toxicity with respect to blood counts. So I think this is one new regimen that is certainly reasonable for patients with mantle cell lymphoma to consider. I think bortezomib as part of a chemotherapy regimen is very, very interesting and something that patients with mantle cell lymphoma who are newly diagnosed should discuss with their doctor as part of their treatment options. It also really highlights the idea of using bortezomib as part of chemotherapy, and this is a subject of several past and ongoing studies, including one national intergroup study, the ECOG 1411 study that's going on across the country, that looks at bendamustine rituximab. Bendamustine is another chemotherapy drug that is now being used much more commonly in mantle cell lymphoma. Bendamustine rituximab alone or with bortezomib as part of the combination, and then looking at various maintenance strategies with either rituximab or rituximab with lenalidomide. So we have a number of new options and a number of new agents, including bortezomib, that are being studied as part of therapy for mantle cell lymphoma. I think this study is one that mantle cell lymphoma patients should pay attention to, and it certainly, I think, provides impetus for consideration for participation in clinical trials where these new drugs are being studied and potentially being brought forward in order to potentially benefit patients to the greatest degree, and so that we can learn exactly how we use these new drugs in sequence or in combination with our standard treatments. I hope this information was useful to you today. Thank you very much for joining me.